Hello everyone. Today is Monday, May 7th, otherwise known as Melanoma Monday. And so as you can imagine, I couldn't let today go by without saying a word or two about melanoma. Now, melanoma is a kind of skin cancer that's always scary. And the reason it's scary is because it can metastasize to other parts of the body and can continue to grow and can even cost somebody his or her life. And so it can be a very serious skin cancer that many times starts out as a mole on the skin, or what an individual may have thought was a mole and in actuality was a lesion of melanoma that was evolving. So it's important for everyone to know how to recognize a lesion that could be melanoma. We always talk about the ABCDEs of melanoma. A is for asymmetry. So a lesion that's neither oval nor round, but has an unusual shape or appearance would be concerning. B is for the border. And if you think about moles that are oval or round, you can pretty much take a pencil or a pen and you can trace out the border very well. Well, whenever it comes to lesions that are concerning to melanoma, you really can't trace out that border because the border kind of fades into the surrounding, and the border may be very irregular. So we talk about an irregular border being concerning for melanoma. C is for color, and whenever we talk about melanoma, we think about the color black, but the reality is that melanoma can be various different colors, and it can be multicolored. So if you ever see any red, pink, purple, blue, white, or gray mixed in with brown, all of that would be concerning. If it's various different colors, that would be concerning. D is for diameter, which is essentially the size of the lesion. And we always talk about how a size of 6 millimeters or greater has a higher risk of being melanoma. Most people think, well, what exactly is 6 millimeters? A good reference point is a pencil eraser. So a lesion that appears to be the size of a pencil eraser or greater could be concerning. And then E is for evolution, which essentially means change. A lesion that is changing, that you know is changing, could be concerning. So A, asymmetry, B for an irregular border, C for color, black being the most concerning, but multiple different colors in brown would be just as concerning. D is for diameter or size. E is for evolution or change. Now, a lesion that happens to have multiple different characteristics that I just described should probably be biopsied to see if it actually is or is not melanoma. Patients frequently ask me when I take a look at their skin, how is it that I identify melanoma when I see it? How can I tell that that's what it is? And what I'm looking for frequently is a stain, something that just looks like a stain on the skin. So if it looks like I should be able to take a cotton ball, dip it in alcohol, and then rub it against the skin and rub off the stain, but the stain does not come off, that is concerning to me. Now, it's important to note that a stain is flat, and in its earliest forms, melanoma is flat. By the time it's bumpy, it's already grown significantly. We want to be able to identify these whenever they're flat, whenever they're early on in the process. If you give it time, it will grow. It will eventually break down and ulcerate. It will eventually bleed, because melanoma will continue to grow. It does not typically remain flat and stable in size. So in summary, don't forget your A, B, C, D, E's. I didn't mention a single word about sun protection, but the truth is that melanoma is a skin cancer that increases with sun exposure. So you want to be protecting yourself from the sun. So anytime that you're going to be outdoors an extended period of time, which in my book means anything greater than 15 minutes, you want to be wearing sunscreen. And I've talked about the different forms of sun protection in the past, so I'm not going to belabor that, but it's important to be practicing those at all times. It's important to not use tanning beds because the use of tanning beds significantly increases the risk of melanoma. And it's also important to avoid sunburns and blistering sunburns in particular, because all of those increase the risk of skin cancer in general and most definitely increase the risk of melanoma. If you notice any particular lesion on yourself or on your family members that happens to have any of the signs of melanoma, A, B, C, D, E, or if you see a lesion that to you looks like a Sharpie marker stain, that's my own personal way of identifying them, then by all means go to a clinic that is supervised by a board certified dermatologist so that you can be evaluated appropriately. From the Alamo City, this is Dr. Ana Sauceda, helping you put your best face forward. Take care.